Hi YouTube, this is Kim. I'm coming on today basically just to give you guys an update about what's been going on these past 2 months. I have my surgery date, which is scheduled for tomorrow, December 13th, at 9 a.m. I'm the very first patient to go in, so I'm very excited about that. I have successfully lost 25 pounds. I currently weighed in last Wednesday at 262. Very happy about that. Um, Again, if you all remember, my starting weight was 287 pounds, 86.66, which is 287 pounds. Highest weight known to date was 290 pounds. So I'm pretty sure I weighed more than that, but that was the highest that I saw actually on the scale. But again, I didn't stand on the scale for years previous to me standing on the scale at that point in time. I'm currently wearing a size 20 jeans. That's down from a size 24 in just 2 short months, basically. 24s are baggy. 22s are starting to be a little bit looser. I mean, the 20s are starting to be a little bit looser than they were when I first initially wore them. The very first time I put on a size 20, it was Thanksgiving Day. And they were quite tight but breathable, which was huge for me because the last time I wore a size 20, I believe I want to say 22. So it's been a long time since I wore a size 20 comfortably. So I'm very glad about that. Right along here, I have my surgery date. I have my measurements, which I'm going to insert in here. Tomorrow's the big day. So I will see you all later. Hopefully I will see you all on the other side of the pre-op. I'll be post-op next time I see you guys. So be well, work out hard. This is the Get Right, Get Tight Nation. Let's go. 2012 is my year. YouTube people, I'm back. Oh my goodness, today is what, the 15th? Let me see. I don't have a calendar. I'm assuming it's the 15th. I went in for my surgery January 13th. I had the surgery. It was very seamless, very quick actually. I came out of surgery, woke up in the recovery room, clunked back out, woke up in the recovery room, clunked back out. The time that I saw on the clock was at 3 o'clock. Apparently I had been in the recovery room for hours at that point in time. So yeah, it's just been pretty. I don't really do surgery. I don't really do anesthesia very well. It's not really my cup of tea. So that would be why I came out of surgery so ugly or so horribly bad. I knew I would. Um, but today is the 15th, which means I only spent one night in the hospital, which I'm very glad of because I don't like hospitals. And I am home. I came home last night on the 14th. At about 6 o'clock, I got home. I am not as tired and not as in much pain as I thought I would be. I actually feel pretty good. I just, it's a lot of gas and I have a lot of, uh, I'm cold. But then again, I live in Western New York, so I guess I would be cold living up here. But I am cold, colder than I normally would be, I think. And I have a lot of gas, which does cause some pain because the gas has to move around. It's not like I just expel the gas like I would normally do. Um, so basically, I'm just going to tell you guys how it went, which I've already done. It was very quick, very seamless. Lots of pain. That first day, on the 13th, basically, when I came out of surgery, lots of pain. Holy mackerel, so much pain, it was retarded. It's like I couldn't get enough drugs in me to kind of take the pain off. I couldn't get warm. I couldn't do anything at all, really. Oh, excuse me, I had to yawn. Even that doesn't feel that great to yawn. Um, Let me see what else. That's about it, really. Just a lot of pain that very first day, so I was really out of it the first day. So people who came to see me and you're watching this video, I greatly apologize. I was just so out of it. If you know anything about me, I don't do pain at all. Minimal pain, sure, not a problem. Pain like that, you're slicing into my body, removing or inputting something or whatever, not my cup of tea. So lots of pain, but I'm okay now. So I came home last night, got into bed, and I pretty much didn't move unless I had to. This morning I slept until 12-ish. I think the only reason I woke up is because my mother called my phone. Otherwise I still would have been asleep. I don't I don't even know why I'm up now. I feel like I could go right back to sleep. Hopefully I'll edit all that out. What else? That's pretty much it, really. I mean, I made my protein shake today. I'm sucking on that very little tiny bit. They say not to use straws because it gives you gas, but I'm not using a straw. I'm drinking out of an open mouth cup, and I still get gas, which is very unwelcoming, but it is what it is. Oh, I know what I'm going to do. Something I have not seen anyone else do, so if people get these questions, then clearly to watch this video and you get your answers. I'm going to show you guys my incisions, or the marks where they are at, which means you guys are also going to see my stomach, which is really gross. Don't judge me. This is why I'm doing this whole surgery thing. So I cannot have this belly. So hopefully everything will go away. I have this thing, they sent me home with this thing called a grenade sticking out of me. Basically, it's a tube that comes from my stomach outside of my body, and it collects in this bowl of a thing called a grenade. Any fluids or anything that comes out of my stomach. That's the best way to see if I have any leakage or anything. Supposed to monitor it to make sure nothing that I'm consuming is in the bowl. And so far, so good. So I'm gonna stand up now. It takes a lot of me to stand up. I'm gonna show you guys my scars. Hopefully you'll be able to see it. So hold on one moment. By the way, my stomach is extremely swollen, like extremely swollen. When I went in, my stomach was not like this. It's like this now, but it was not like that when I went in. So again, don't judge me. Okay, let me cover up a little something. Just gonna show you guys my scars. All right, let me see if I come in. All right. That's one. It's on my right side, right now underneath my boob area. There's one right here. One here. Oh, here we go. Here goes another one. In the middle of my chest, basically, between my boobs. There's one there. This is the grenade. I had to staple it. I stapled it, but pin it to my shirt so it doesn't just dangle because it's only in there by one stitch, and I don't want to rip that stitch out. So that's 1, 2, 3, 4, and then where my stomach came out at, which is right here. Let me see if you guys can see it. I know that's so super duper gross, and that's where that comes from. So that's what I got. That is what they sent me home looking like, and it really, really, really hurts. Probably because I'm so cold. I don't know. I know this much though. I have a very, very sore throat. I'm assuming it's from when they put the tube down your throat. Very, very sore, very, very dry mouth. I'm assuming that's all from when they insert the tube down your throat and into your, esophagus and on down the way it goes. That's what I'm assuming it's from. Hopefully that will go away shortly. Outside of that, I'm pretty good. I don't really have any complaints or any concerns really. Um, this is was it day 2 post VSG. So I am now on the other side. I am now post surgery. I'm very happy. So I'll be making more videos and let you guys know what's going on with me and how I feel and pain and things to that effect. So far, Get Right, Get Tight Nation is still underway. It's just not really getting tight or getting right. It's just making it work. I am walking. That's something I am doing. They told me to walk, and that's the only thing I can do. So I am definitely walking. It's very, very cold outside, so I'm not walking outside yet because that means I have to put on socks and sneakers and long pants, and this is a long thing to do. Well, yeah, but I am lapping around my house basically a lot, probably more than I probably should. Cause I'm doing a lot of getting up and getting down, but I think in the long run it's gonna help. I know how much I can handle, so I'm doing the best that I can right now. So the next time I make a video will hopefully be after this lovely grenade thing is removed from my body next week. And I can, conversate with you all again. Outside of that, I'll see you guys later. Toodles.